Your healthcare provider has approved for you and your caregiver to receive training on how to access your implanted port. This instructional video will help you access your port effectively, comfortably, and safely. Do not attempt to access your port without discussing with your healthcare provider and receiving education from your nurse. To get started, select a clean work area. Once established, clean your hands thoroughly using antibacterial soap and warm water. If no soap and water is available, use an alcohol-based hand sanitizer, followed by drying your hands with a clean towel. If anesthetic cream has been applied, wipe off with a clean cloth or paper towel. Palpate the implanted port for the center of the port. The insertion site feels spongy. Clean your hands thoroughly using antibacterial soap and warm water. Gather your supplies as instructed: flush syringes, medication if applicable, non-coring port needle, injection cap, port access kit, sharps container. Next, prepare the sterile field by carefully opening the dressing change tray. Remove and place one of the masks on yourself. If you have a caregiver assisting you, they should also put on their mask at this time. Remove the 2 sets of sterile gloves and set them aside, leaving them in their packages. Create the sterile field by opening the towel as instructed by your nurse. Do not touch the top surface. Carefully open and empty all the supplies from the tray onto the center of the sterile towel without touching any of the items or allowing the outer packaging to touch the sterile towel. Following this, open the port needle, injection cap, and sterile flush syringes onto the sterile towel. Finally, put on sterile gloves as instructed by your nurse. Remember to only touch supplies on your sterile field with your sterile gloves. If you touch something outside the field, you will need to discard the gloves and start again. You are now ready to prepare your port needle and flush syringes. Screw the injection cap into the end of the port needle tubing and set aside on the sterile field. Prior to using syringes, push firmly on the thumb press with the tip cap still on, just until you feel the plunger move. Expel air and excess solution by twisting off the tip cap and pushing the plunger forward. Push out extra solution to the amount instructed by your nurse. Finally, replace the syringe cap, being careful not to touch the tip of the syringe with anything that is not sterile. If it does, you will need to start over with a clean syringe. Set aside the syringes until you are ready to use them. Repeat this step for all flush syringes needed. You are now ready to flush the port needle extension set with saline. Remove the protective cap from the sterile saline flush syringe. Attach the sterile saline flush syringe to the injection cap and unclamp the tubing. Flush slowly until the needle and tubing are filled with fluid and a few drops of saline come out of the capped needle. Lastly, clamp the tubing, leaving the sterile saline flush syringe connected to the injection cap. You are now ready to prepare the port site for accessing. Remember, you are still wearing sterile gloves. If the gloves have become contaminated, change into new sterile gloves at any time. Scrub the insertion site with a chlorhexidine applicator, working in a back and forth, up and down motion for a total of 30 seconds. If you are using a different cleaning solution other than chlorhexidine, please follow the alternate instructions provided by your nurse. Allow the site to air dry thoroughly. When the clean port site is dry, you are ready to access your port. Remove the needle guard from the Huber needle. Stabilize the port by placing a finger thumb of your non-dominant hand on either side of the port. While holding the port steady with your non-dominant hand, firmly insert the needle at a 90-degree angle until you feel the end of the needle hit the back of the port. Carefully release the needle and unclamp the tubing. Pull back gently on the plunger of the syringe. You should begin to see blood come into the tubing. Stop pulling as soon as you see blood. If you do not have a blood return, call your nurse or pharmacist, as this may mean the needle is not in the right place. Once you see blood return, flush the tubing with a sterile saline syringe using a push-pause method. Lastly, clamp the tubing. If you are leaving your port accessed, apply the dressing. Once the dressing is applied, you may infuse any ordered medications as instructed by your nurse. If medications are not to be infused until later, or if you are de-accessing your port, flush the port needle extension set with heparin, unless your port has a Groshong tip, such as a power port. This will conclude accessing an implanted port. If you are removing a port needle, please refer to the education materials on removing an implanted port needle. Each time you access your implanted port, you will get more comfortable with the supplies and the steps. For any questions or concerns you might have, please contact our highly trained specialty nurses who will help you understand the basics of home infusion therapy and will answer any questions.